From now on, those infected with COVID-19 are allowed to visit pharmacies in person to have their prescriptions filled out. To minimize the number of seriously ill COVID-19 patients, doctors will visit patients at nursing facilities to provide healthcare services. Although the government is trying to transition the nation to normal life, it's taking a cautious stance with regard to declaring COVID-19 an endemic.
A nursing home in Gyeonggi-do Province. A medical staff takes a temperature and checks the blood pressure of an 80-something-year-old patient who already recovered from COVID-19 and completed her quarantine.
열 체크 한 번만 할게요. 네, 정상입니다.
Nursing facilities have been prone to mass outbreaks lately. One of the patients at this nursing home developed a fever and began vomiting after contracting a virus and eventually passed away because he wasn't transported to a hospital on time.
시간이 많이 지체되거나 아니면 오더라도 이제 원하는 병원을 못 가고 계속 거쳐서 여러 군데를 돌아서 결국 멀리 있는 병원까지 이송이 되거나 결국은 위중증으로.
Health authorities have decided to set up teams in charge of nursing facilities at 45 hospitals in a bid to reduce the number of seriously ill COVID patients. Some 70 teams will visit assisted living facilities in person to provide health care to the infected. Each team consists of one doctor and at least one nurse. They'll be working in teams until the end of this month. From now on, COVID-19 patients receiving treatment at home are also allowed to visit pharmacies in person themselves to retrieve their prescriptions. They can either bring their prescriptions firsthand or have their clinics send them to pharmacies via fax so that pharmacies can prepare the medicine in advance. To reduce the risk of contamination, health authorities have requested pharmacists to wear KF94 masks and set up separate spaces for the infected. However, some drugstores are concerned.
지금 전파율이 너무 높다 보니까 대면하는 상황에서 조제하고 이제 투약하고 접수하고 결제까지 다 해야 된다는 그런 사실 자체가 조금 부담이 안 될 수는 없죠.
Korea added over 224,000 COVID-19 cases as of midnight Thursday, 61,000 fewer than the day before. Now that the number of Omicron cases are declining, the government is discussing a gradual return to normalcy. But it's stressing once more this does not imply a transition to the endemic phase yet, nor the halting of COVID-19 responses altogether.